start frying fish, then you are not doing yourself any good. Because already you are already adding cholesterol to yourself. If you tell me you eat boiled fish, or you smoke the fish, and you eat it, then I agree with you. Do you understand? Next slide, please. And decreasing your sodium intake, I've told you. If you don't need to, salt is not food. By the time you use your you know what, locust beans. Locust beans, you use crayfish in one soup. Locust beans, crayfish, and all these local things that we have, you use it. Just a little salt, just a little pinch, it's fine. Or you use just only Maggi and don't put salt. The food will taste better. It's not by the time you put salt inside the food that makes the food sweet. It only affects your life. Affects the heart adversely. It's the heart that gets into danger with it because it's like poison to it. Regularly you are poisoning the heart. You wake up in the morning, you poison it with white Maggi. In the afternoon, you poison it with black Maggi. You just keep poisoning it with every kind of Maggi because we want to make it sweet. Next slide. No, that's fine. Then you have to maintain a healthy weight. If you are overweight or obese, if you are overweight or obese, you have to try to lose weight. Then if you have to drink alcohol, for men, in moderation, 2 drinks per day for men. For women, 1. A glass of drink for a woman is fine. 300 mils. 300 mils. 300 mils not to a bottle now. You know, a bottle, there are some mils. I think you have to take alcohol. No. Wine is wine. Whatever it is. If you take spirit, I'm not asking you to take spirit. Alcohol, I'm talking of ordinary beers. Yeah. Yes. Ordinary beers. If you take spirit, you take 300. You have even killed yourself before time. No, yes, it's high. There's some percentage of alcohol that is 45%. There's 54%. There's 75%. Mommy, am I right? Liver, kidneys. Those are the places it goes straight. And these are the things that help the heart in building the blood. So by the time those things that are building the blood are destroyed, how does the heart pump the blood to your body and feed it? Diabetes sets in, hypertension gets in, renal failure sets in. Just because of what I'm going to eat or what I want to drink. So there's no two way about it. If you are smoking, stop. I didn't say you can smoke 2 sticks or you can smoke 1. Stop. Entirely. Stop. Next slide. Okay. So you stop entirely for smoking. Next slide. Thank you. Okay, you get a routine health assessment I talked about at the beginning and blood pressure screening. Just normally, I want to live healthy. Okay, fine, there's nothing wrong with me. Oh, I've not seen a doctor in the last 3 months, in the last 6 months. I just want to check. You can just go into any chemist shop, you can check your blood pressure there. At worst, they will collect 20 naira or 15 naira, 100 naira, just check it. That gives you an idea. Okay, I'm still in a good range. Do you understand? Taking your blood pressure medications are directed even if you are feeling fine. Those people that have gotten to a stage where their blood pressures are high and they are needed, because by the time we see all this dietary, exercise, everything I talked about, those people that are still in pre-hypertension and hypertensive state, class 1, as a 140 to 90. If you can adhere to this thing religiously, as if, this is the biblical injunction, if I follow it, except the person has a family history of hypertension. If you adhere to all these lifestyle modification we've talked about, the blood pressure will come back to normal. But once he has gotten to certified hypertensive, then you have to start using medications. And medication you will not prescribe by yourself. You will not say, oh, Lagbaja is using moderatic, let me use moderatic too. It will help. No. Do you understand? Or somebody is using Aldomet. I want to add it to my life too. Okay. So you have to go to the doctor has to see you, and when you use this medication, as Lagbaja is Mr. X or Mrs. X is reacting to one house please. As Mrs. X is how good Mrs. X reacts to Aldomet doesn't mean Mrs. Y will react that way. But the 2 of them can react the same way. As in, it can be good for the 2 of them, but it will not. The drug may not be too good for Y. X doesn't have side effects, Y has side effects. And because Y has side effects, I'm not using this medicine, they are really taking soon. Once back to that, some people, once they use Aldomet like this, they can't sleep. Whereas some people, once they use Aldomet, their life is fine. So because they have used it, and it's not, and it's, yes, their blood pressure is coming down fine, but they're not feeling good. They just on their own stop those drugs. No, it's not for you to stop the drug. By the time you use a drug the doctor gives you for that blood pressure, and it's making you uncomfortable, or it has changed a part of your lifestyle, you go to the doctor, he reviews the drug. Not because the doctor wants to eat your money. Yes, he will eat your money because you will come and meet him. Don't. So you understand? But by the time you go, it's just for your good. He removes that one that is offending you and gives you a better one. And sometimes if that one is still offending you, it might just be that it only needs to reduce the dosage. And one thing about hypertensive drugs, you really have to use them for life. But at the initial stage, you might be using as much as 4 to 5, sometimes just 3. But if you're a consistent, regular, and not claiming defaulter, with time you begin to reduce the dosage. Then at the end of the day, you might just be needing only one drug to ginger the heart to do the work it's doing, if you are adherent. So from a 2 weeks clinic that you're attending, you will come to a 1 month clinic. Doctor say, okay, you're done very well, come and see me in 6 weeks time. You are doing so very well, come in 6 months time. And with time, you like, before you know it, you now start having 1 year appointment. That appointment is just make sure that the heart is still functional. Okay, we're almost done. So get routine assessments, blood pressure, taking your blood pressure medications, and reduce stress and practice relaxation techniques. Relaxation techniques, dancing is a relaxation technique, and all that. Next slide, let me see. I think I'm done. Okay, next slide. Next slide, losing weight, we talked about it. Those other medications, we talked about it. Oh well, that's all about we have to talk about. Then the diabetes thing. You know, we have talked about our blood sugars. Okay. Diabetes is just as bad as hypertension. When your normal blood sugar level, sorry, I can talk only in milligrams, like in millimoles, is between 6.5. No, that's what I'm trying to say. I should convert it. Sorry. Okay. Times 18. Just multiply whatever I tell you, multiply it by 18. So between the normal range is between, once you are 4.5 to 6.5.
We should check.
No, it's not there. You have to multiply whatever.
That's 80.
Which one is the sugar level here? RBS. So what's the normal one? The normal level?
And that's what I'm trying to tell you. The normal level, when you are not hungry, it's between 4.5